Here's a demonstration of spiking and priming tubing and IV fluid. First, compare the IV container label with the MAR. Remove your IV bag from the outer wrapper. Check expiration dates. If needed, you can scan the barcode on the IV bag. Be sure to compare the patient's identification band with the MAR as well. Maintain aseptic technique when opening sterile packages and IV solution. Remove your administration set from the package. You'll also note on the administration set packaging that you will see important information such as the drip factor. Be sure to apply a label to the tubing that reflects the day, the time for your next set change. This is usually 72 to 96 hours, but will depend on your facility guidelines. Be sure to keep the ends of the tubing sterile. Now we will go over the parts of the tubing. Your first thing that you'll see is the spike with the cap. The cap helps to keep the sterility. The venting cap is next. That's used for certain types of containers like glass containers. Next, you have a drip chamber. This is what you will squeeze to fill solution about halfway. Next, you have your roller clamp. In order to clamp off your solution, you roll it downward. You need to do this as soon as you open your IV tubing package. Next, you have a slide clamp. It's another method of stopping the solution. So that's off, and now that's open. Next is your proximal or closest to the patient infusion port. There is usually a second one that is closer to the drip chamber as well that is used for piggybacks. Last, there is a connector port, and the blue cap is what helps to protect and keep the sterility of the end of the tubing, which is very important. Next, we will close the roller clamp on the IV administration set. We will invert the IV solution container and remove the cap on the entry site. The entry site is the one with the blue cap. The other site is an injection port, and it should only be used for injection of other medications and not to be used for spiking the bag. Remove the cap from the spike on the administration set, and using a twisting and pushing motion, insert the administration set spike into the entry site of the IV container. Next, you will squeeze the drip chamber and fill at least halfway. Next, we're going to hang the IV container on a pole or a door hook right now. We're going to open the IV tubing clamp and allow fluid to move through the tubing. Allow fluid to flow until all air bubbles have disappeared and the entire length of the tubing is primed or filled with solution. Close your clamp, and it is normal to see those few drops of solution at the end of the tubing, which means the fluid has gone all the way through. Now it's time to clean your IV site with an alcohol pad. Be sure to scrub that hub. Ensure that your patient's IV is unclamped or open. Now you will remove the cap at the end of your tubing, and you will push the end of the tubing into the IV and turn. And that is it.